He's an operating room nurse turned integrative therapist. Now he's offering hospital patients at the UConn Health Center contemplative care or alternative healing to help with their pain, anxiety, and sleep troubles. Edward Dailey joins us this morning to tell us more about how he's helping patients recover more quickly. Good morning, Edward. How are you? Okay, let's first start. What are these alternative methods that we're talking about?
So we're talking about yoga, which includes in-bed movements, in-chair movements for circulation. We're talking about breath awareness techniques, meditation techniques in the yoga component. We're also talking about Reiki, aromatherapy, nutrition, and contemplative care, or care for patients nearing the end of their life.
How do you decide which method to use?
It depends. Sometimes we go into the room and it's very much patient-driven. And so I sit down and listen to the patient, listen to their needs, listen to what's going on with them, and then decide what's actually best for them at that moment in time.
What kind of results have you seen? I'm sure a lot of people want to know, does this work?
We have seen outstanding results. We're reducing pain by over 3 to 4 points on most occasions, seeing a reduction in anxiety, blood pressures are down, pulse rates are down, and the most important thing, Monica, is that patient satisfaction is up. They are extremely satisfied. In fact, every patient that I touched has said that they would come back to the health center for these experiences again.
Now, you mentioned patients. Are patients at all skeptical about this type of healing at first? I'd have to imagine some would be.
Yes, they are. And so when that happens, again, nothing is forced upon them. Sometimes it may be the first introduction is just sitting and listening to the patient and talking with them. And then I may see them repetitively over time, over the course of their hospital stay. And they tend to warm up after that, or they'll see their partner in the room with them. I'll work with them, and they'll see that there's a favorable result, and they'll want me to treat them.
What do you tell them? Do you give them other examples of people that you've helped before? How do you get them over that skepticism?
There's a lot of conversation and there's a lot of discussion. Yes, we use examples of how it's been beneficial in the past, but also I think it's the experience of what actually happens that really wins them over.
Okay, why did you make the change? You went from the operating room nurse to this integrative therapist. Why make that change?
Well, I had been involved in a lot of these modalities for several years. I've been practicing yoga for almost 20 years, and I saw the benefits of it not only to myself, but having spent time at Beth Israel Medical Center in Manhattan on the floor using those techniques with the oncology and surgical patients there with, again, outstanding results. And I said, why not replicate that here in Connecticut?
Fantastic. Thank you so much. That's Edward Dailey from the UConn Health Center. Thank you so much for shedding light on some alternative healing procedures.
Thank you.